Hello, everyone, and welcome to our webinar from Workplace Suicide Prevention. Today, we're going to be talking about work-related stressors and suicide, lessons learned from a UK qualitative study with Sarah Waters. Professor Sarah Waters is a professor in French studies from the University of Leeds in the UK. She's the author of Suicide Voices, Labor Trauma in France, which was published last year and serves as one of the preeminent global suicide researchers. She is also a main campaigner of Hazards UK, which she'll be talking about in this conversation. I'd like to acknowledge the collaborative partnership behind workplace suicide prevention. It is a three-legged stool with the American Association of Suicidology, the American Foundation for Suicide Prevention, and United Suicide Survivors International. The National Guidelines for Workplace Suicide Prevention hosts these webinars regularly, and today the goals are to discuss some of the workplace factors, both at the organizational level and the managerial level that may drive suicide, to talk about some recent evidence coming out of the UK based on the qualitative study led by Professor Waters, and to make some evidence-based recommendations. The National Guidelines for Workplace Suicide Prevention is founded upon 8 guiding principles. And today, the guiding principle that we will be discussing is harm reduction. And all of these guiding principles cut across all of our practices, whether it's upstream practices that are proactive and preventative in nature, or midstream, where we're trying to catch things as they emerge, or downstream when we're responding to crisis. Harm reduction applies to all of these. So I will now turn it over to Sarah to tell us why this principle is important and what it entails. Welcome, Sarah.
Thank you very much, Sally. It's a real pleasure to be here with you, and thank you for giving me this opportunity to talk about our study. So I'd like to talk about a study we carried out in the UK, which has just come out. It was published last month. And the aim of the study was to investigate some of the psychosocial hazards or stressors that drive work-related suicide in the UK context. So we carried out a qualitative study of 12 recent cases of suicide. In each of the cases, work-related factors had already been identified by an official source, by, say, the police, the coroner, or in an employer's investigation. And our aim was to really dig deep, to do some detailed research on the circumstances surrounding each of these cases of suicide. We wanted to consider all of the complex, individual, often contradictory factors that tend to be sometimes overlooked in more extensive quantitative studies, that are often overlooked or unseen in studies that work purely on a statistical level. And I think as researchers, we often tend to get caught up in the figures, to get caught up in the statistics, and to forget about the real lives, the real people, and the real trauma that lies behind every single case of suicide. So we had a number of research questions at the start of this project. And these questions were: why does work or conditions of work push some employees to take their own lives? What are the organizational and managerial factors that might drive suicide? And what can we do to reduce or mitigate these risks? In the study, we looked at a whole multiplicity of sources. We looked at documentary evidence, coroner's reports, police reports, employers' investigations, internal workplace material, suicide notes, emails. And we also interviewed bereaved family members and colleagues linked to each case of suicide. So I suppose in terms of our approach or methodology, we're very much shaped by the work of the American sociologist Jack Douglas, who published a really interesting book that goes back to 1967 called The Social Meanings of Suicide. For Douglas, there is no predefined meaning of suicide. He was quite critical of the statistical approach and the statistical tradition for studying suicide, which comes down from Emil Durkheim. He said the only way to understand suicide is to look at the meaning given to it by the suicidal individual, him or herself, and by his or her family, loved ones, and the people involved in that person's life. In order to arrive at a sense of the meaning of suicide, we then need to reconstruct those events. We need to speak to bereaved family members. We need to consider all of the documentation. We need to look at all of the narratives surrounding that case of suicide in order to understand what it's about. Next slide, please. Okay, so this just sets out the details of the study. It was funded by the University of Leeds and by Research England. These are the researchers who were involved: Sarah Waters, Hilda Palmer, and Amy Chandler as a consultant. Next slide, please. Some background on suicides in the UK context. In the UK, suicide rates are rising in the present time. The highest rates are amongst working age men. This is a really important statistic that we wanted to address. It's a well-known fact that working age men have the highest rates of suicide, but there is little research as to why, as to how work or working conditions shape suicide. Certain occupations have higher suicide rates. Construction workers have the highest rates for men, care workers for women. Construction workers, we know that's an international phenomenon. I know that Sally Spencer Thomas has worked on this. And so construction workers have very high rates of suicide across the international sphere. The UK government has looked increasingly at mental health in the workplace. It's increasingly interested in addressing the mental health crisis in the workplace. It commissioned a Thriving at Work report, which found that there are more people with mental health conditions than ever before, and at a far greater rate than physical health conditions. At the same time, suicide charities, trade unions, professional associations all point to a mental health crisis in the workplace. One of the issues that we have come across is that suicide is rarely included or considered as a factor in the mental health crisis in the workplace. It's generally excluded from discussions on workplace mental health. Next slide, please. So, as I mentioned, we were working on a small sample, and in all cases, work-related factors had already been identified. We wanted to look at what those stressors were across our sample. In half of the cases, unmanageable workloads were a contributory factor, and in a quarter of cases, it was the main stressor that we found. So these were employees who were completely overworked, who were burdened with so many different tasks and roles that their working lives had really spiraled out of control. There was a sense of chaos. There was a sense of their working lives being unmanageable, that they could no longer cope. There is a sense of a lack of control, a sense of being overwhelmed. It's interesting that in Japan, this phenomenon is already well recognized. Karo jitsatu, or suicide by overwork, is a recognized phenomenon linked to unmanageable workloads. To give you a concrete example, we looked at the case of a school teacher who had a very, very busy and full teaching timetable, but she was encouraged, if not pushed, to take on an additional management role. And for her, this was really a tipping point and the start of her decline. She went on sick leave a few months after taking on the new role. And 2 months after the commencement of her sick leave, when she was due to return to work, she very tragically took her own life. But there were other examples across the sample. We had a university professor who was working, all hours, evenings, weekends, who would complain that he couldn't take an annual vacation because he was so overworked. His wife reported that at the time of his suicide, he was marking 418 exam papers. He explicitly referred to workload in the suicide note that he left. Linked to this is the phenomenon of long and irregular working hours. We know already through different studies that long, irregular, unpredictable working hours are a stressor, are a psychosocial hazard in suicide. In our sample, we had the case of a 35-year-old nurse who was working very long and unpredictable shifts. She had complained to her family and friends that the unpredictable nature of her work meant that she couldn't settle down. She couldn't build proper relationships. She couldn't start a family because her work was just so irregular and unpredictable. Change in work status. So this is employees who take on, often reluctantly, take on an additional role that they find difficult to cope with. We had the case of a consultant cardiologist who, when a colleague of his went on sick leave, ended up working in 2 roles. There wasn't a replacement found for the colleague who went on sick leave, and he ended up in a situation where he was combining 2 very intense, very demanding, relentless roles, which led to a complete burnout and a subsequent suicide. We had cases of workplace bullying, both of which involved, quite sadly, young employees. One was 21, one was 18. And what we found was that this bullying had in both cases been reported, but it wasn't taken seriously. The management in both cases hadn't deemed the bullying serious enough to act upon. And sadly, in both cases, it resulted in a suicide. Exposure to trauma. We studied 2 cases of firemen, and we had a policeman suicide, a police officer suicide. In each of these cases, the employee had been exposed to an incident of violence, where in 2 cases, colleagues of theirs had died. And the effects of the trauma following those incidents weren't properly understood, weren't properly managed, weren't properly diagnosed by management. In one of the cases concerning a fireman, he was given a posthumous diagnosis of post-traumatic stress disorder. In other words, the diagnosis came very tragically after he had taken his own life. So these stressors, I think, are well known and are established in current research on work-related suicide. And what we wanted to do really was to find some of the contextual detail, look closely at the personal circumstances, to find out how these stressors affected the individual, how they were experienced by the individual, and to look at observations by family members, by colleagues as to what took place. Next slide, please. Okay, so in 11 of the 12 cases we looked at, workplace factors, either organizational or managerial, were identified as a stressor. This wasn't a surprising finding in that we specifically chose cases where work-related factors had previously been identified. We found in our sample that suicides are linked to a diverse range of causes. Unmanageable workloads, bullying, sickness absence, irregular hours. I would say a common characteristic across all of these cases is that the employee loses a sense of control, loses a sense of autonomy over their working lives. In 9 of the cases we looked at, employers were aware of the problems affecting an employee prior to the suicide. These problems had been reported to management either formally through a performance evaluation, an annual staff survey, or had been reported to management, reported to a line manager informally through email or conversation. And I think that is probably one of the difficult findings of our study, that in fact, in many cases, the suicides might have been prevented had the right action taken place at a certain time, had managers, had mental health training, had the person had their workloads adjusted in the light of their formal or informal complaints. Next slide, please. So just a brief overview of the UK response to this mental health crisis in the workplace. The Health and Safety Executive, which is the regulator for health and safety in the workplace in the UK, has done significant work on stress management, on providing guidelines on psychosocial risks. Our main criticism is that the Health and Safety Executive excludes suicide from its work on stress and on psychosocial risks. It doesn't, in the UK at present, workplace suicides are not reported to any public agency. So if an employee breaks a leg, if an employee has a fracture of an arm or a leg that is deemed to be work-related, that legally has to be reported to the Health and Safety Executive. If an employee takes his or her life in the workplace, that doesn't need to be reported to any public agency. And for us, this is, a huge risk, and it is a huge oversight in current regulation of work-related suicides in the UK. Public Health England, which is another advisory body, has produced really helpful mental health toolkits for employers, which provide guidelines on raising awareness of mental health, on providing a positive culture, on providing mental health support. One of our recommendations in our study is to, alongside providing these very helpful guidelines for employers, is to put enforceable regulations in place. At the moment in the UK, employers are not obliged, as I've said, to report a work-related suicide. They're not obliged to undertake an investigation in the aftermath of a suicide. They're not obliged to put any suicide prevention measures in place. So we believe quite strongly that voluntary guidelines that depend on the goodwill of an employer have to be combined with enforceable rules and obligations that protect the health and safety of all employees. I am involved in a trade union hazards campaign on work-related suicide that is pushing for workplace suicide to be included in the work-related deaths that have to be reported to the health and safety executive for further investigation. Next slide, please. So this is the postcard that Hazard has produced, and that has encouraged trade unions, employers to send to the HSE in order to further our campaign. And our point is work-related suicides are not reportable. They are not counted. They are not a workplace prevention priority, and they should be. Our key message is they are not counted and therefore do not count. And we need to change the narrative, which at the moment treats work-related or workplace suicide as a private voluntary act, and we need to bring it in to a health and safety remit. I think the national guidelines on workplace suicide prevention in the US are brilliant, because they bring together all of the different agencies, all of the different organizations who are invested in workplace suicide prevention, and provide a coherent, joined up set of guidelines. We don't have that yet in the UK, much as we would like to. Next slide, please. So this is really a snapshot of some of the recommendations that came out of our report. The importance of having proper systems in place to oversee workload, to take complaints about unmanageable workloads seriously, and to, balance workload, to balance work pressures, which are very important, against the well-being and mental health of an employee, to draw up a suicide plan, to communicate openly and honestly in the aftermath of a suicide. The bereaved colleagues we spoke to often complained that the communication following a suicide was often not very open. There was a desire to shut down discussion of what had happened, to bury it. And what they wanted more than anything else was to talk about it, to confront what had happened, and to have an honest discussion about what had taken place. Mental health training for managers is crucial, particularly in the emergency services, where we found that in our interviews, colleagues of employees who had taken their own lives complained that managers were often, not properly trained to understand, to recognize, and to respond to the poor symptoms of mental health. Another key demand is for an independent investigation to be undertaken by the employer in the aftermath of an employee suicide. At the moment, this is only done in the UK on a voluntary basis. An employer can decide either to undertake an investigation or not to undertake an investigation. And we believe that an investigation should be standard protocol in the aftermath of a suicide that takes place in the workplace or that is work-related. Next slide, please. So these are some of the key resources and references, including at the top of the page a link to the report that I've just been talking about, and some other helpful resources. Next slide. Sally.
Yes, thank you so much, Professor Waters, for this incredible, groundbreaking study and for sharing the work that's happening over in the UK. We continue to learn from each other. To all of our employers out there, or professional associations, labor unions, please go to workplacesuicideprevention.com and take the pledge to make suicide prevention a health and safety priority for your organization.